Welcome and thank you for being here. I'm Dr. Shin, and today our goal is to help you clearly understand your thyroid and how deeply it influences your entire body. We'll walk through the common signs and symptoms of both low and high thyroid function and what your lab tests really mean and the different medication options available. We'll also explore how nutrition, key nutrients like iodine and selenium, and lifestyle or environmental factors can either support or disrupt thyroid function. And by the end of the session, you'll feel more informed and empowered to support your thyroid health in partnership with your healthcare providers. And please remember this information is for educational purposes only and is not a substitute for personalized medical care. And always make sure to consult your healthcare provider for guidance specific to you. All right, so what does the thyroid do? The thyroid is a small butterfly-shaped gland in your neck, but it affects nearly every cell in your body. Its main job is to control metabolic rate, how fast or slow your cells produce energy. And it produces T4, which is the storage hormone, and T3, which is the active hormone. Most T3 is actually produced outside the thyroid, especially in the liver and our gut. This is why gut health, liver health, and nutrient levels all matter for thyroid function. If this conversion doesn't work well, you may still feel hypothyroid symptoms even if your T4 levels are normal. And just a little overview of hypothyroid. So hypothyroidism means that the body isn't getting enough thyroid hormone effect. This may be due to low hormone production, poor conversion, or resistance at the tissue level. In the US, the most common cause is autoimmune thyroid disease, and the immune system mistakenly attacks the thyroid in the autoimmune. And globally, the most common cause remains iodine deficiency, but this is rare in North America due to iodized salt. And women are much more affected due to immune and hormonal influences because estrogen plays a role in our immune activation. And this is why thyroid disease is common in our reproductive years. And some causes of hypothyroidism. There are several causes of low thyroid function. The most common is autoimmune, Hashimoto. Postpartum thyroiditis is actually quite common as well, and it can occur months after childbirth. Many women are misdiagnosed with depression or burnout, and certain medications like lithium and amiodarone can also suppress thyroid function, and other nutrient deficiencies, especially iron and selenium, can impair hormone production and conversion. And secondary hypothyroidism can occur when the pituitary gland doesn't produce enough thyroid stimulating hormone. This is less common, but it is important to identify. So what happens in Hashimoto's? In autoimmune thyroid disease, antibodies such as anti-TPO, so thyroid peroxidase, attack the thyroid tissue, and this causes inflammation and progressive damage. Interestingly, the disease can often start with the hyperthyroid phase, and this happens because damaged thyroid cells can actually release stored hormones, and over time, hormone production decreases. And autoimmune thyroid disease is actually an inflammatory condition, not simply a hormone deficiency. And we'll talk more about that in a later slide. The thyroid is especially vulnerable to environmental toxins because it actively pulls in the iodine. Unfortunately, it also pulls in similar chemicals like perchlorate and fluoride. And these compounds can increase the oxidative stress and it can trigger immune activation. And research has shown associations between endocrine disrupting chemicals such as BPA and thyroid dysfunction. And these chemicals can alter the hormone signaling and immune regulation, which is why reducing toxin exposure can be a helpful part of thyroid support. Some of the hypothyroid symptoms. So, hypothyroidism can affect almost every system in the body because thyroid hormone regulates metabolism at the cellular level. The most common symptom by far is fatigue. It's reported in up to 80% of patients. Dry skin, feeling cold when others aren't, and constipation are also very common. Many patients also experience brain fog, memory changes, or difficulty concentrating. Cardiovascular symptoms can include reduced exercise tolerance, shortness of breath with activity, and sometimes a slower heart rate. And thyroid hormone also affects cholesterol metabolism. So, untreated hypothyroidism can worsen the cholesterol levels and contribute to elevated blood pressure. And in women, thyroid dysfunction can impact reproductive health. It may cause irregular or heavy cycles, difficulty ovulating, and infertility. In fact, the American Thyroid Association recommends checking thyroid function in women being evaluated for infertility or recurrent miscarriage. Other common symptoms include hair thinning, depression, muscle cramps, joint pain, hoarseness, and sometimes numbness or tingling sensations. It's important to understand that all these symptoms are not specific to thyroid disease. Many people without thyroid dysfunction report similar symptoms, and interestingly, some patients with true hypothyroidism have very few symptoms at all, especially in older adults. And these are some labs that we would order for if we were to suspect hypothyroidism. And when we evaluate thyroid function, we don't just look at one lab. We typically run a full thyroid panel because each marker tells us something different. First is thyroid stimulating hormone, TSH, which is a signal from the brain, specifically the pituitary gland, telling the thyroid how to work and how hard to work. It doesn't measure the thyroid hormone directly. It's more like the thermostat signal. If TSH is high, the brain is asking for more thyroid hormone. If it's low, it's asking for less. Next is free T4. This is a storage form of thyroid hormone circulating in your blood. It shows how much hormone the thyroid gland is producing. Then we look at free T3, which is the active hormone your cells actually use for energy, metabolism, mood, and brain function. Some people have a normal TSH but still feel poorly because they aren't converting the T4 into T3 efficiently. In those cases, free T3 can be low even when TSH looks normal. We also check thyroid antibodies, thyroid peroxidase antibodies, and thyroid globulin antibodies. And these tell us whether the immune system is attacking the thyroid, which is called autoimmune thyroid disease or Hashimoto's. Antibodies can also show up years before thyroid hormone levels become abnormal. So identifying them early on allows us to intervene sooner and potentially slow the progression. Finally, we would measure reverse T3. Reverse T3 is an inactive form of thyroid hormone. Under stress, illness, inflammation, or calorie restriction, the body may convert more T4 into reverse T3 instead of active T3, which can contribute to symptoms even when other labs appear within range. And one important thing to understand is that lab reference ranges are based on population average, not necessarily optimal health. So in our clinical practice, we often use narrower optimal ranges because research suggests that many people feel best within a tighter window than what's printed on the lab report. The gut and thyroid connection. So autoimmune disease often begin in the gut. Increased intestinal permeability allows immune exposure to proteins that can trigger autoimmune responses. And there's a strong association between celiac disease and thyroid autoimmunity. Studies show that gluten-free diets can reduce the antibodies in some patients. And gut healing strategies can look like probiotics, L-glutamine, addressing infections like candida overgrowth and bacterial overgrowth. And this approach is really about calming the immune system and not just replacing the thyroid hormones. And the nutrient status plays a major role in hormone production, conversion, and immune regulation. There are four nutrients I routinely assess in practice: iron level through ferritin, selenium, zinc, and vitamin D. So iron deficiency is incredibly common, especially in menstruating women. And what many people don't realize is that iron is required for thyroid hormone production. So the enzyme thyroid peroxidase, which helps produce T4 and T3, is iron dependent. If ferritin levels are low, even if hemoglobin looks normal, patients can still experience fatigue, hair loss, poor thyroid conversion, and persistent symptoms despite being on medication. And for optimal thyroid support, we typically want ferritin in a more functional range, 60 to 80, not just barely within the lab reference limit. And selenium is also critical for the enzymes called dioiodinases, which convert T4 into active T3. It also supports the glutathione production and protects the thyroid gland from oxidative stress. The thyroid contains one of the highest concentrations of selenium in the body. Multiple studies in Hashimoto's patients showed that selenium supplementation can reduce the thyroid peroxidase antibodies, particularly in individuals who are already deficient. So selenium isn't just about conversion, it's about calming the autoimmune activity once again. And easiest way to get daily intake of selenium is by eating 2 Brazil nuts per day. And zinc. So zinc supports thyroid hormone synthesis in the gland itself, and it also plays a role in thyroid stimulating hormone regulation from the pituitary. Low zinc can impair both production and conversion of thyroid hormone. And clinically, zinc deficiency can show up as hair loss, poor wound healing, low appetite, or reduced immune resilience, symptoms that can overlap with thyroid dysfunction, which is why it's important to assess that. And eating a handful of pumpkin seeds per day can be optimal for daily zinc intake. And lastly, low vitamin D levels have been strongly associated with autoimmune thyroid disease in multiple observational studies. We consistently see higher rates of deficiency in patients with Hashimoto and Graves' disease. And vitamin D helps modulate the immune system, and it may reduce inflammatory signaling that drives the antibody production. And optimizing vitamin D doesn't replace thyroid medication, obviously, but it can be a supportive piece in managing the autoimmune thyroid activity. So the iodine is essential for thyroid hormone production as well. Every molecule of T4 and T3 contains iodine, and without it, the thyroid simply cannot function. This is a non-negotiable nutrient. But iodine follows a U-shaped curve. Too little is harmful and too much can also be harmful. On the deficiency side, severe iodine deficiency can lead to hypothyroidism and goiter. In pregnancy, it's especially critical because iodine is necessary for fetal brain development. And adults generally need about 50 to 150 micrograms daily, with higher needs during pregnancy and breastfeeding. With mild to moderate deficiency of iodine, the body can actually compensate. The pituitary increases the TSH and the thyroid increases the iodine uptake. Over time, however, chronic stimulation can lead to enlargement and nodules. And if iodine intake is suddenly increased in that setting, it can also trigger hyperthyroidism. And now when it comes to excess iodine, too much iodine can actually disrupt the thyroid function as well. In people with thyroid disease, prior deficiency, or autoimmunity, excess iodine can actually trigger either hypo or hyperthyroidism. And after the iodine fortification programs in countries like China and Denmark, rates of those thyroid antibodies and hyperthyroidism actually increase before stabilizing over time. And yeah, so overall, because of the U-shaped relationship that the iodine has with thyroid health, American Thyroid Association advises against high-dose iodine supplementation in people with normal thyroid function. Goitrogens and thyroid function. So goitrogens are substances that can interfere with thyroid hormone production or metabolism. The term comes from goiter because in certain settings, these compounds can contribute to thyroid enlargement or hypothyroidism. But the key point here is context, especially your iodine status. Goitrogens affect the thyroid in several ways. Some can inhibit the iodine uptake into the gland. Examples include thiocyanate, which is found in tobacco smoke and in cruciferous vegetables, as well as environmental compounds like perchlorate and nitrate. Others can block thyroid peroxidase or TPO, the enzyme responsible for incorporating iodine into thyroid hormone. And soy isoflavones are a commonly discussed example of this mechanism. And certain medications like lithium can also impair hormone release, and some drugs increase hepatic metabolism of thyroid hormones, leading to lower circulating levels. And so I know that sounds really alarming, but here is the reassuring part. In iodine sufficient population, most dietary goitrogens pose minimal clinical risk. For example, common cruciferous vegetables like broccoli and kale contain relatively low amount of goitrin, so it is typically not enough to meaningfully impair your thyroid function in someone with adequate iodine intake. Larger amounts, such as in collard green or Brussels sprouts, theoretically can have greater potential, but it is still a rare cause in iodine replete individuals. Where goitrogens become more clinically significant is in the setting of iodine deficiency. Iodine deficiency amplifies their effects, while adequate iodine intake is protective. That's why goiter prevalence can vary geographically and why some population consuming similar food experience thyroid dysfunction while others do not. And so the takeaway is this: cruciferous vegetables are not the enemy. For most patients, especially those with adequate iodine intake, they are safe and beneficial. And the bigger picture overall is the nutrient status. So hyperthyroidism, most common cause, Graves' disease, is where the immune system stimulates the thyroid instead of damaging it. This results in excess hormone production, and some of the common triggers are stress, infection, and smoking. And hyperthyroidism increases the metabolic rate, which can cause anxiety, insomnia, palpitations, and it can also increase your bone loss and cardiovascular risk if it's not treated. And in Graves' disease, there may be a diffusely enlarged thyroid gland, and some patients can actually develop eye involvement, which can include redness, swelling around the eyes, lid retraction, or bulging of the eyes. And labs to identify hyperthyroidism. When we evaluate the hyperthyroidism, first and most important lab is TSH. According to the American Academy of Family Physicians, TSH is the initial screening just because how sensitive it is. And if the TSH is suppressed, meaning very low, that raises concern for hyperthyroidism. And the free T4 and T3 in hyperthyroidism are usually elevated, which can confirm the thyroid toxicosis, meaning there's too much thyroid hormone in circulation. And once it is confirmed that someone has hyperthyroidism, the next question is, what's causing it? If the cause isn't obvious, we check the TSH receptor antibodies specific for Graves' disease. And if the diagnosis is still unclear, then we can do a radioactive iodine uptake scan, which can help differentiate between Graves' disease, toxic nodules, and thyroiditis. some of the thyroid medication options. So for hypothyroidism, there are three main medication approaches. The first and most common is levothyroxine, which is synthetic T4. T4 is a storage hormone, and the body converts it into T3, the active hormone used for energy, metabolism, mood, and cognition. And the levothyroxine has a longer half-life, and it provides very stable level. And it is first-line therapy just because of the strong safety data. And for many patients, this does work very well. However, some patients still can have symptoms despite normal TSH level. About 10 to 15% may have relatively low T3 levels on the levo alone. So in those cases, we may consider adding liothyronine, which is T3. And this combination therapy can improve energy, mood, and cognitive symptoms in selected patients. But just know that T3 is more potent and it acts quickly, and it can cause palpitation, anxiety, and sleep disturbance if it's overdosed. So it really requires careful monitoring and is not used in pregnancy. A third option is desiccated thyroid, which contains both T4 and T3 in a fixed ratio that is higher in T3 than what humans naturally produce. So when patients start with the desiccated thyroid, they may feel better on it, while others can feel overstimulated. Because the ratio isn't fixed, we can't just independently adjust the T4 and T3. And I've looked more into it that with the desiccated thyroid. Right now, they're on the fence about discontinuing it by August of this year. So that we are still just continuing to check the availability. And now, if we're treating the Graves' disease or hyperthyroidism, the approach is different. First-line therapy for many patients is anti-thyroid medication, most commonly methimazole. These medications work by blocking the thyroid hormone production, allowing levels to gradually normalize over weeks. And it usually continues for 12 to 18 months, and some patients can achieve remission. But usually relapse can occur, and so we just have to make sure we continue to monitor. And the next slide. So let's talk about stress, because this is one of the biggest missing pieces in thyroid health. When we're under chronic stress, our body can produce more cortisol, and cortisol is meant to help us survive short-term stress. But when it stays elevated for a long period of time, it starts to interfere with how your thyroid works. For example, cortisol can reduce the conversion of T4 into T3, which is active thyroid hormone. And so you might have normal labs, but still feel fatigued, cold, foggy, or stuck in low energy mode. And chronic stress can also increase reverse T3, which blocks thyroid receptors, and it makes it harder for your cells to respond to thyroid hormones. And we also know that stress can change how sensitive your thyroid receptors are. So even if you have enough hormones, your body's just not able to respond to it efficiently. This is one reason why some patients don't feel better even after starting the thyroid medication. And this is why it's also important that we look at the whole nervous system and stress physiology. And let's also talk about sleep, because sleep is where your body repairs your endocrine system. Even mild sleep deprivation can affect the thyroid function. Research shows that sleep loss can alter TSH rhythms and disrupt hormone signaling. In other words, your thyroid relies heavily on your circadian rhythm. When sleep is inconsistent, hormone communication between the brain and thyroid becomes dysregulated. Sleep is also when your body resets cortisol level. If you're not sleeping well, cortisol stays elevated, inflammation increases, and your body remains in a survival state rather than a healing state. This is why many patients notice their thyroid symptoms worsen during stressful life seasons or periods of poor sleep, like postpartum, during major transitions, or when working night shift. Another important piece is trauma and immune health. We know from research that emotional trauma, infection, or major stress events can trigger autoimmune conditions in genetically susceptible individuals. The immune system becomes dysregulated, and the body may begin attacking its own tissues, including the thyroid. This is why many people with autoimmune thyroid conditions like Hashimoto often report a major life stressor, illness, or emotional event before their diagnosis. True thyroid healing often requires calming the stress response, improving sleep quality, and restoring nervous system balance. And this is where lifestyle medicine, trauma-informed care, and mind-body therapies become incredibly crucial. And one of the most powerful things you can start with is lifestyle and nutrition. And one of the way is stabilizing your blood sugar. When your blood sugar is up and down all day, your body produces more cortisol, which is your main stress hormone. Over time, that can increase inflammation and directly affect how your thyroid works. So eating regular meals with protein, healthy fats, and fiber can make a big difference in your energy, mood, and thyroid function. Another key piece is omega-3 fats. These healthy fats can also help calm inflammation and support immune balance. And foods like wild-caught fish, walnut, chia seeds, and flax have omega-3. And many of patients also notice that they feel much better when they reduce caffeine. And this doesn't mean that you have to give up your morning ritual, but switching to gentler adaptogenic coffee alternatives can also help support your nervous system and reduce stress on your thyroid. And one big category we briefly talked about earlier is environmental exposure. Certain chemicals called halides like fluoride, chlorine, bromide, and perchlorate can block the iodine from entering the thyroid. And since iodine is essential for thyroid hormone production, this can interfere with thyroid function over time. So simple changes like this can help: drinking and bathing in filtered water, limiting chlorine exposure when possible, choosing fluoride-free toothpaste, using more natural, environmentally friendly cleaning products, being mindful of flame retardants in furniture and clothing when possible. And pesticide is another important factor. Research has shown that exposure to certain pesticide is also associated with higher rates of thyroid dysfunction. And we also want to be mindful of plastic. Chemicals like BPA and phthalates can disrupt thyroid hormone signaling. And the structure of BPA is actually very similar to thyroid hormone, which allows it to interfere with how your body uses the hormone. And heavy metals like mercury can also trigger immune response and have been linked to increased thyroid antibodies. So choosing low mercury wild-caught seafood is also a great way to still get the benefit of fish while reducing the risk. And lastly, let's talk about food. Cruciferous vegetables like broccoli, kale, and cauliflower, they are incredibly healthy and anti-inflammatory, but again, in large amounts, especially raw, they can slow the thyroid activity if you're iodine deficient. And good news is that cooking them can reduce the effect significantly. So you don't need to avoid them, just enjoy them cooked and in balance. And finally, gluten. In some individuals, the immune system can confuse gluten proteins with thyroid tissue, which can also worsen the autoimmune thyroid disease. This is why some patients feel better when they reduce or remove gluten completely. Right. So to wrap everything up, here are some most important things I want you to remember from today. First, your thyroid affects almost every part of your body. It's not just about weight or energy. It impacts your mood, digestion, hair, skin, hormones, fertility, and heart health. So if you don't feel like yourself, it is definitely worth looking deeper, even if your basic labs are normal. Second, in the US, the most common cause of low thyroid is Hashimoto, which means the immune system is involved. This is why simply taking thyroid medication doesn't always fix the root problem. We also need to calm the inflammation and support the immune system. And third, thyroid disease often develops slowly. Antibodies can show up years before hormone levels change, so early testing and prevention really matter. And gut health also plays a big role. Many autoimmune conditions are connected to the gut. For some people, improving digestion and identifying food sensitivities and healing leaky gut can make a big difference. And nutrients are foundational. Things like selenium, iron, zinc, and vitamin D are essential for thyroid hormone production and conversion. And more iodine is not always better. In fact, too much iodine can make autoimmune thyroid worse. Um, and lifestyle factors like stress, sleep, and blood sugar balance have a huge impact on thyroid function. And finally, that thyroid health is not one size fits all. The goal is not just normal labs, it's helping you feel better, have more energy, and support your long-term health. So this month, focusing on nurturing the key areas that support your thyroid and overall well-being starts by checking in with your body. How's your energy, mood, digestion, and hair health? Nutrition is essential. Aim for selenium, zinc, iron, and vitamin D from whole foods and moderate goitrogens. Sleep and stress management are also important. Even small changes like consistent bedtime, short walks, or mindful breathing can also help your thyroid function. And gentle movement supports your heart, circulation, and metabolism. And finally, tune in to your mind-body connection. Noticing patterns, triggers, and mood shifts can also help guide your health decisions. Right. Thank you for joining us. Do you guys